Good afternoon, ladies and gentlemen, and welcome to the final Care Vision's Healthy Aging conversation for this year. We've had an amazing array of speakers during the course of the year, as many people who've been regular viewers of this programme would have seen. And we've got an exceptionally interesting programme this afternoon coming up with my guest, Professor Philp, who I'll introduce in just a couple of minutes when we get to 4 o'clock. But whilst you're just settling in, getting your cups of tea and getting warm and cosy for the winter evening ahead, let me just give you an update on some of the material that Care Vision's Healthy Aging has been producing. Regulars of this programme will know that Care Visions is now doing a whole series of live classes to help people age well, with a mixture of programmes to stimulate your mind, look after your emotional well-being, and actually look after your physical well-being as well. There's around 20 different classes that you can enrol free of charge to any of those through the Care Vision's Facebook site, which is the way that you've got to this programme this afternoon. There was a new one that started this week, actually yesterday on Monday at 12:30. There's a new yoga CBT, that's cognitive behavioural therapy. That really just a way of introducing how through yoga you can reduce anxiety and manage your stress and control your fears, really give yourself a better quality of life. And that started this week at 12:30 on a Monday, but it will continue next week. So it's not too late to join that class next week. On Wednesday, tomorrow, just to highlight a few of the classes, at 9 o'clock in the morning, there's a Pilates class, one of our most popular classes of people who learn how to do Pilates as a way of toning themselves up and keeping fit and healthy. At 10:30, improvisation acting by Sophie, the acting instructor. And this is about giving yourself a chance to learn how to act and enjoy a bit of acting with your fellow participants. And then at 2 o'clock in the afternoon, a dance class takes place as well. So if you're into acting or dance, Wednesday is your day. 10:30 improvisation acting and 2 o'clock dance. And then at 3:30 in the afternoon, the second, I think it is, of the classes with Jana, who's doing Italian cooking. So again, participate and learn how to cook with Italian ingredients and make some delicious meals with Jana tomorrow afternoon at 3:30. Coming up on Thursday at 10 o'clock, there's a mobility flow fitness class, 11:30 art class. So you don't have to be an artist, you can just be a complete beginner to enjoy the art class. At 2 o'clock, the couch concert, where you can sit back and enjoy some music. And at 3:30, in case you're getting too relaxed, there's a workout to tone yourself up for the end of the day. And then finally on Friday, just to highlight a couple of the opportunities coming up on Friday, our monthly book club happens on Friday. And some of you may have already enrolled in that, but that this month is looking at Charles Dickens' A Christmas Carol. And it's the 177th anniversary of the publication of Charles Dickens. And as people who've already joined the book club know, it's being run by Lucinda Hawksley, who's the great-great-great-granddaughter of Charles Dickens. So she'll be talking us through A Christmas Carol and comparing with everybody in the book club what they think of the book and what they enjoyed about it in particular. So that's 11 o'clock on Friday morning. And then at 2 o'clock in the afternoon, we continue the literary theme with Harry Langham, our resident poet. And this in his poetry class on 2 o'clock on Friday afternoon. This week he's looking at where do poets get their inspiration from? Where does that flash of genius come from that leads a poet to be the amazing person who writes the words that we all enjoy so much? So that's the poetry class with Harry Langham at 2 o'clock on Friday afternoon. And as with all of the Care Vision's classes, the idea is to offer you a menu of different classes that help you with your physical activity, your cognitive strength, and your emotional well-being. So please do not just join one class, but look at joining other ones across a range of different activities. So we're now just about on 4 o'clock, and I'm delighted to welcome this afternoon Professor Philp. Hello, Ian. Thank you for joining us this afternoon. So Professor Philp is the founder and CEO of Aged Care Technologies, which we'll come and talk about in a short while. He's also part-time professor of global aging at the University of Stirling, an advisor to the World Health Organization. He holds a doctorate in medicine from the University of Edinburgh and was a practicing physician for 35 years in the NHS. As Professor of Healthcare for Older People at the University of Sheffield, He led teams which won the UK Hospital Team of the Year in the care of older people and the Queen's Anniversary Prize for Higher Education for research into improving the quality of life of older people. From 2000 to 2008, he was the National Clinical Director for Older People in England, leading the development and implementation of the NHS framework for older people, campaigning to ensure respect and dignity in care and eliminate age discrimination. And in 2009 was awarded the CBE in the Queen's Birthday Honours in recognition of his work supporting older people. So nobody really better qualified to comment on the state of health and well-being for older people in the nation today than Ian. So Ian, let me start, because we're all feeling a bit sort of under it because of coronavirus. Let me start by just asking you to share something that you've enjoyed in the past week that's brought a smile to your face and made you feel a bit uplifted when we're all feeling, I would say, a bit in the depths of winter.
Thanks, Jeremy. Well, I'm actually tempted to say the classes that you've described that care vision, they're right on the mark in terms of promoting healthy aging. I'll maybe come back to explain why I think that in a bit. I guess the honest answer in the last week is that I'm doing a program for small business leaders to create high growth that's sponsored by Aston Business School. And learning now to turn my hand to the business model. And as part of that, I had to do an impact assessment. And we looked out then 10 years from now, and we're looking to, as our mission, significantly improve the lives of 100 million older people by 2030. And I did the calculations based on our model for the interventions we've got that on average add a year of extra life, quality life to an older person, and compress morbidity by about a year with a long-term care cost saving. And when we did the numbers, if we achieve our social mission, we would save the global system $12 trillion. It's bizarre. Wow. It's 12,000,000,000,000,000,000, a mind-boggling figure. And it brought it home to me that, you know, setting an ambitious target, which we think is achievable, can have a very significant impact. And that made me smile, because I thought, okay, what we're doing is worthwhile.
So it's not only improving the well-being of individuals, but actually governments should be picking up and thinking this is a more cost-effective way of supporting people as they get older than the way we do it at the moment.
Yeah, because my lifetime's work in health and care systems has been done in the face of what I regard as a large level of ignorance by governments about what really works for older people. And governments are well-intentioned, but badly informed sometimes about the things that can really make a difference, and then how we have to drive these changes through our care systems.
Well, that's a really good story, and then really good and quite inspiring bit of work that you're doing. So it could transform healthy aging and care around the world. Now, what about bringing it right down to the personal? What about for you? What's your personal recipe of success? What do you do to keep yourself mentally and physically alert week by week?
Well, I was fortunate to be involved in designing and then presenting a TV program on ITV called 100 Years Younger in 21 Days, where we took a bunch of celebrities off to Sardinia for 3 weeks, and in the face of their personalities and behaviors tried to well, as background research, I had the chance to speak to most of the world's leading experts on longevity. And from a sort of synthesis of their views and publications, it seems as though there were 8 things that really mattered. And I've tried to apply these lessons in my own life. And I think everybody can pick something up from them. And the reason I was smiling when you were talking about the classes is they hit a number of these top things that help us age well. And the 8 that I've tried to apply in my own life start with number 1, social connection. Over everything else, social connection. Because it's social connection that drives positive behavior. And then number 2 is clean air. And that's as you know, Jeremy, the impact on conditions as diverse as dementia to heart disease, lung disease, the pollution in the atmosphere is a really big driver as of course is smoking as a detriment to living well as we live
Mhm.
longer. But then the three behavioral things that the classes relate to is physical activity of any type, building it into the thing that suits you, mental activity, particularly learning new skills like a language
Mhm.
or art, as you mentioned. And then number three is stress, control, sleep. So doing the things that allow you to eliminate the worry things that keep you up at night.
Mhm.
So they're all really well-founded things. So I try and adopt these. And then diet, and you mentioned the Italian cookery class. And the thing about the diet is not just what you eat. It's actually as important how you eat. So
Right.
taking time to prepare fresh food, eating in a social way, where food is part of a celebration of life, is as beneficial as the actual content of the food itself. And then something that people are perhaps not so aware of is as you get older, your self-esteem based on your physical appearance matters for your longevity. And it matters as much for men as it does for women. Something about men as they get older, really worrying about their loss of masculinity or virility and their appearance. So actually one of the big things I did was, my wife's been going on at me for years to moisturize. And having learned the value of skin appearance, I now have a moisturizing regime. And then the last thing is in all of that, and I think it's a wraparound as well, is about purpose.
Right.
We all need purpose in our lives. And that's really what propelled me, that evidence about purpose, to not just take my retirement on the golf course, but to find something to do in my 7th decade.
Right. So tell me, go back to the very first of those, because it's a wonderful list of 8 points, and I'll ask you to come back at the end and remind us what the 8 are. But take the first of those about socialization. Is there been a real issue this year? Because obviously with COVID, people have been very isolated. There've been a lot of people shielding. Do you have some concerns about the impact that's having? Is there any evidence to show that that's having a detrimental effect on people's long-term well-being?
Well, without a doubt, the loneliness and isolation that many older people have felt has had a huge impact on their well-being. And we know that, excuse me, we know that that has as much of a detrimental effect on your just straightforward longevity, this sense of loneliness and isolation, as many other things or any other thing does. And I worry terribly for older people who are isolated at home, or you can be isolated in a communal setting if you don't have meaningful social connection with the people around you. Now, it's too early to say what the impact will be on
But
death.
if you put the first and last of your 8 together, so socialization and purpose,
Yes.
they probably do go together, don't they? Because if you've got a purpose, it probably means you're connecting with people and trying to achieve something. And it's not just sort of socialization for its own sake, but it's socialization to achieve a result. So maybe those two together can have a beneficial effect. I must just, before we go any further, remind people that if they want to ask a question, we'll have a few minutes at the end. So if you have a question for Professor Philp, please do use the chat function on Facebook to ask your question, and we'll come to those at the end. But let's move into that area you were talking about. So I think the third of those, you were talking about mental stimulation and learning something new. People are often very nervous about doing that because they think they won't be very good at it. And they think, oh, I've not learned a language since I was at school. Does it matter how good you get, or is it the act of doing it that's important?
It's the act of doing it with pleasure. People won't continue to do things unless they're getting some satisfaction from it. Yeah, as you get older, you realize that you're not going to become a tennis champion or a top rugby player or a concert pianist, but you can and you should continue to try and learn new skills because of the personal satisfaction that gives you. So I think this fear of competitive pressure does put people off, you're right. But we shouldn't. We should embrace the new and do it with pleasure, do it with a friend, and enjoy learning. Actually, many people who are at the very top of their game, if it's a sport or a craft, will say the most enjoyable time they experienced was when they were rapidly improving, rather than when you're at the top and trying to keep there. So, you know, within a matter of weeks and getting into a new sport, a hobby or craft, will give you, I can guarantee, enormous satisfaction, and it will be good for you. It will help you live longer, live better.
And what about the amount of time you spend doing it? Because there's been lots of advice, I think, about physical activity, although some seems quite contradictory. So I know the NHS guideline is, I think, 150 minutes of activity, but the WHO, just in the last couple of weeks, seems to have come out with something that's double that. So what is the right amount of physical activity that we should be doing each week?
Well, Katie Caw, who's one of the UK's leading experts on exercise and longevity at the University of Cambridge, produced a study that showed that any exercise increase is beneficial. So this isn't a binary thing. I mean, there are thresholds that we can reach that produce greater benefit. The picture here, I think, is about building in exercise into your daily life. So, you know, people that live on a hill live longer than people that live on the flat because they have to go up and down the hill every day. That's one of the reasons why Sardinian men live longest in life, because many of them are shepherds and they live in a vertical environment. The women don't live quite as long because they stay at home more often. So I think build in these things, and also there's a mix of exercise. So I like the fact that that Care Visions are putting on, you know, yoga and classes that are low impact on joints and tendons, but produce the stretch and produce the toning. And I recommend actually a mix of flexibility, balance, posture, aerobic exercise. It doesn't have to be making you really out of breath, just enough to feel warm and slightly feeling your breathing, and resistance exercise of some sort. So it's about finding the thing that works for you and building it into your daily life, so you don't even notice the fact that you're doing it.
It doesn't need to, so the intensity doesn't matter, because I've heard people say just gardening, for example, is good exercise. It doesn't need to be super strenuous. And as you said, Ian, it sounds like it's good advice to say do what you enjoy and build it in, because you won't keep doing it unless you're enjoying it.
Yeah, this no pain, no gain story is nonsense. And if you're a masochist, if there's too much pain, you won't continue. So it's get your motivation up by getting your reward.
Yeah. No, I was going to say, so we've got an idea there about physical exercise. What about the amount of sort of mental stimulation each week? Should you can you quantify what people should be doing, how much they should be doing, and what kinds of activities?
Well, any challenging mental activity that makes you think in a new way stimulates the neural circuits in your brain, which is the key to raising your cognitive performance. So again, it's not just doing stuff, it's doing new stuff with your brain, learning things. And I'd say it's you know, it's similar. If you can find things that you really enjoy, you'll do lots of it. And the more you do, the better it is.
And does it need to be new? So I've heard tell that doing the crossword, if you've always done the crossword in the Times or the Telegraph, and you've done it for the last 20 or 30 years, that's probably not as achieving as much, because you sort of know the formula, as doing something completely different. Is that right? Is it the newness is important? That's
correct, Jeremy. If you only stick to what you've done, you'll get some benefit by maintaining your cognitive performance in a particular area, but it won't give you nearly as much benefit as if you changed the crossword for a Sudoku or something like that.
Right. Now, I suppose the big question for me is, are we getting better at all of this? Because one of the things that is often said is that although life expectancy has increased quite a lot in the last 50 years, life expectancy in good health hasn't increased by anything like as much. Are we on the right path, or are we on the wrong path? Are we getting better at being healthy as we age, or is it not working at the moment?
It's working for some people, it's working in some places, and the opposite is happening in other places. The interesting stuff from the UK is that both good and bad things are happening at the same time. And overall, we are extending healthy active life, but we're also extending the period of disability prior to death.
Right.
And it is affecting different groups differentially. If you're really lucky and you're born to a wealthy family in California right now, you can expect to live in really good health till you're 90. In really good health till you're 90. And we describe a phenomenon called the 30 wasted years between 60 and 90, because if you don't have all these privileges of the best lifestyle, wealth, opportunity, education to give you these foundations, you are more likely to suffer a prolonged period of disability prior to death. And if you live to 90, maybe the last 17 years could be spent in a state of disability, or you might not get there. And if you're coming particularly from a socioeconomically deprived background, your life expectancy goes down, but you're still going to be affected by disabilities prior to death. So the public health challenge, and I'm so glad that Care Visions are embracing this and providing solutions, are to give people the tools not to waste that 30 years of life. Give people the tools so people can enjoy their 30 years between 60 and 90. And then I think most of us would accept that if we have really good years to that age, and then we have a short period of frailty in our 10th day, and then we slip away and pass on. Most people would accept that as the a reasonable goal.
Yes.
I certainly do. I hope that's what I get. But unfortunately, it's not all going in that direction. We haven't optimized the opportunities of healthy aging.
Right. And then there's been a lot of talk in the last couple of years, and I know it's written into the NHS plan, about what's called social prescribing. Is that a move in the right direction? And what exactly is social prescribing?
It's a move in the right direction. It's the real basis of my business. And the insight that I've had goes way back to 1963, which was that 2/3 of the things which most matter to older people for their health, independence and well-being are not reported, or are just reported too late. Loss of vision, loss of cognitive function, pain, but also social isolation, financial insufficiency, and so on. And what we've found through 30 years of research is that in any country in the world, in any care system, if we ask people, older people, what it is that's really bothering them, we can usually find sources of support to address that concern.
Right.
And social prescribing is a mechanism to pull in the resources which are needed to address the concern that an older person would have. And so we have the Aged Care Technologies Assessment Tool, which allows older people to identify their concerns and then connects them to largely community voluntary assets that address their needs, resulting on average in a year of extra quality life.
So can you explain what that is? So you said Aged Care Technologies Assessment Tool. What does that mean in practice? What do people have to do to use that, and how does it work?
Yeah, we have to train assessors who can be volunteers or frontline care staff in how to use the ACT assessment to run through the 52 concerns that we know from the literature are the things that most bother older people and have the greatest impact on their healthy aging, and run through these. During the training, we identify the local assets that can address the needs. And so that when the assessor sits down with the older person or does a telephone assessment, they run through that. The older person then says, this is a concern for me. And at the end, they prioritize the 2 or 3 things which the older person most wants help with. And then we mobilize support using a social prescribing model, which essentially is saying, if necessary, go to your GP or go to the benefits agency or go to your leisure club, because there you will find the solution for the concern that you've got. And then we follow up at 3 months and we find out what's happened. And we find out that it makes a difference. And that if there are other things to deal with, then we can pick them up. So over time, you manage to pick off one by one the things that are bothering the older person. And while you might not be able to eliminate the underlying problem, if it was pain due to arthritis, for example, you might not be able to cure the arthritis, but you can find relief through attending an arthritis club that practices techniques for pain relief, or dare I say, going to a Care Vision session.
So it sounds quite complicated. If it's 52 criteria, is this available to anyone anywhere, or is it only some people who can get access to this assessment?
Done in 50 countries. The thing is, people always say reduce it to 7 or 10 things. But I think, as you know, Jeremy, older people become increasingly complex in their needs and problems as they age. And it's not a limit on the older person to go through in a systematic way these things. Many times the older person will just say, well, no one's asked me that before. So what we're trying to do is bring simplicity to complexity, to find a structured way. And that conversation could take an hour.
Right.
Why it's an hour well spent if it gives you an extra year of life, quality life.
So if I was interested in this, can I go to my GP and say I want an aged care technology assessment, or would the GP look at me blankly and say, what are you on about?
My job in the next year is to make people aware of what we've got. The GP right now wouldn't know. My hope is in a year's time they would, because this is definitely, it's not the whole solution. We want to be part of a whole range of people that are innovating and producing solutions for older people, but we are part of the solution, and I hope that there will be awareness of our work with GPs in future.
And how do you build up confidence in this new approach? Because talking about social prescribing and the kinds of things you've been talking about, people are, I think, well trained and expect that if they go to the doctor, they'll come back with a prescription that they take to the chemist and they get some tablets or something that makes them better. Sounds like your whole recipe to success, and it ties into what Care Visions is doing, is an alternative approach, which is about a person taking control themselves and not just being prescribed drugs. But is there a sort of a change of people's expectation that we've got to put in place so that they don't assume that going to the doctor means they come away with a drug treatment, and that there's non-drug treatments that can be just as effective? Well,
I think you can do this work with the support of the doctor, but without the doctor having to be in charge. That's the first thing.
Just explain that, because we're used to the doctor being in charge. So if we need to see a doctor if we want to get a prescribed medication, but we don't need to necessarily see a doctor to get access to a befriending service. And provided the GP is able to facilitate the people they care for to be able to go to a place where they can get that advice and doesn't stand in the way. So you don't want the GP to be the block. But in my view, it's a huge strength in the UK, our primary care system, with 97% of the population registered with their GP. And I did a bit of general practice, although I wanted to specialize in geriatrics to understand older people's care from the GP's point of view. And, general practice is not all just a medical model. There's medical expertise, but the basis of the great doctor-patient relationship is a consultation that allows the patient to say what's bothering them, and then the GP to clarify that and then suggest and offer solutions. And the best GPs and most GPs have this holistic approach. Armed with the tool of social prescribing, will be able to help older people address the things that really matter to them. Right. And do you think we're giving this enough attention? Is the government giving this enough attention, or does it need a bit of a ramp up? One of the people I had on this programme a few weeks ago was the Older People's Commissioner from Wales, and she pointed out that we don't have an Older People's Commissioner for England, and thought that maybe we should. Is there not enough attention at the moment, or is it getting on the agenda in the way it should?
It's never had the same attention as it had when Frank Dobson was the Secretary of State for Health and Alan Milburn followed him in England. where older people's care was a genuine top 6 priority.
Okay.
Halfway through my time as the National Clinical Director, because of personnel changes and so on, I was told you're no longer a priority. It's just heart disease, cancer, and access. And we slipped back into these things. And I had to fight a long campaign to get dementia and stroke up there as national priorities. But unfortunately, you have to educate, I think, every generation of politicians about why it matters to get things right for older people. And it matters because if we don't get it right for older people, our care system gets overwhelmed. But that's not the main reason we have to get it right for older people. We have to get it right for older people because older people are the main people that use the National Health Service.
Yes.
And we have to have the right model of care for them.
And it goes back to what you said at the beginning about the priority and the amount of money that could be better spent if we got the system working better.
Exactly. Because we in their last year of life, the majority of people that live beyond the age of 80 spend more than half of that last year in and out of hospital.
Right.
Maybe the first time makes sense, but after you've been through a hospital care for an emergency episode because of frailty, it would be much better. Most older people would say, well, next time I want to be treated, but treat me at home.
Yes.
Because we don't want to spend that last year in and out of hospital. And if we were able to make just that one change to the system, and there are moves in that direction now, which is very good to see.
Yeah.
We would both save a lot of money, and we'd free up hospitals to treat everybody, young and old, who really needs to be there.
Well, that's a good message. Now, I've got a couple of questions. I know we're going to run out of time, and I do want you to run through those 8 points again before we finish. So let me just ask you, I've got a few questions, probably won't get through them all, but one from Nigel, somebody called Nigel says, most technology seems very complicated and confusing to use. What can be done about that? So I think that is, and I've seen that with my mother-in-law. She finds even the remote control for the television a bit beyond her ability to understand and use. So is there something about making sure that technology, which can make an enormous difference, is a bit more accessible than it is often the case?
Yes, and we should be working with schools of design and engineering with panels of older people to create the ergonomics that work for older people. And there's a saying that Bernard Isaacs, a famous geriatrician years ago, used to say, which was, if you design for older people, you get it right for everyone. But
yes,
if you don't design with older people in mind, then older people get excluded from the use of technologies.
That's a good message. Well, and then there's a link question I'll just squeeze in from Anne, who says, which I think it must be uppermost, that again on the technology and the equipment that people can get to support them. Can I get funding to buy the equipment that I need? And it goes back to, I think, your point about financial health and well-being is an important factor, isn't it?
It's a very important factor. Money gives people agency, which is why there was a move to introduce personal budgets for older people, that you get more control over how the money that's spent to keep you well and healthy is spent on the things that matter to you. But it is a bit of a maze. What I would say is that honestly, spend the money you've got, if you've got money, to look after your health and the things that will give you health, well-being and independence. And then it's the duty of the state to make sure that personal financial resources is not a barrier to getting things that really matter to you. Easier said than done, but that's a challenge for policy.
It's a good principle, yeah, it's a good principle. Right, Ian, we're bang on time, so I just want to give you a minute or so to run through the 8 points that you said at the beginning of if you like, the recipe for healthy aging. Just run through those 8 points again for everybody, because that'd be really helpful to end.
Okay. Keep up your social connection, whether it's superficial with a large number or deep relationships with a smaller number, both benefit you. Look for clean air, don't smoke, try and give your lungs some breathing. If you live in a polluted area, try and get away, at least for a couple of weeks a year, to give your lungs a rest. Build up your physical activity into your daily life. Take up new things that challenge your mind, as that will improve your brain function. Manage your stress giving yourself a sense of control that will help you sleep, and techniques like mindfulness do really help with that. Diet, have a good diet, but it's as much how you eat, fresh cooking your meals, enjoying your meals in company. That will really help you. Look after your appearance. Even if you're an old guy like me that never moisturized, start moisturizing. It does improve you a little bit, makes you look about 3 years younger, and that's very good for your self-esteem. And then wrap that round with a sense of purpose. Do things which you feel at the end of your life you can look back on and say, well, yeah, I did that, and that gave meaning to my life, and there was a reason why I had my life. And that actually is what many older people will say allows them to face their death with equanimity.
Yes.
They felt they'd had a life that was worth living.
Great. Well, Professor Ian Philp, thank you so much for being my guest this afternoon. I think you've given everyone their New Year's resolutions, and it's probably true to say it's never too late to start. I think that's an important message, that on any of those 8 points, just because you haven't done it before, you can start at any age and you can get benefit at any age. So, Professor Ian Philp, thank you so much for joining me. We're now going to take a break in the Healthy Aging Conversations, but we'll be back on Tuesday, the 12th of January, with Kate Lee, the Chief Executive of Alzheimer's Society, will be joining me on the 12th of January. But meanwhile, everybody, have a very Merry Christmas and wishing you a Happy New Year. Thank you again, Ian.
Thank you. Merry Christmas.